everyone, it's Joyce the dentist. Have you ever wondered what exactly a dental implant is and why they're so popular for people who need to replace their missing teeth? You know, 20 or 30 years ago, if you had a missing tooth, you're probably getting a dental bridge made to fill in the gap or a removable partial denture to wear. But today, dental implants offer us this minimally invasive and long-term alternative that's actually better for your mouth overall. Essentially, dental implants are these hypoallergenic rods or screws that mimic the size and strength of a tooth root. When an implant is placed in the spot where your tooth is missing, they can support a restoration on top of them, like a crown or even paired together for a dental bridge, without having to rely on the adjacent teeth for support. Implants are so strong that dentists use as few as 4 to 6 implants total to restore an entire arch of upper or lower teeth at one time. The material that dental implants are made from is extremely bio-friendly and so hypoallergenic that your bone actually adheres to the surface, fusing with it and permanently anchoring it into your smile like your other teeth. Once your new implant is fully integrated, your dentist can restore it and the entire unit works together almost exactly like a natural tooth. This is great because it means you don't have to cut down the adjacent teeth to install a bridge or worry about a partial denture rubbing and damaging the teeth adjacent to it. Now, one of the biggest concerns I get about dental implants is, does it hurt? I mean, after all, if you're just looking at a picture of a dental implant, it can seem a little scary to most people. Well, get this. Most implant patients will actually tell you that's easier having their implant installed than it's getting a tooth pulled. Since your bone doesn't have any nerve endings in it, the only thing you usually feel is a little pressure. Your gums may be tender afterwards from where the small incision was made, but that's about it. When you're talking about a single implant installation, all the surgeon does is put a little numbing cream or medication and local anesthesia to keep that area nice and comfortable. And if you're getting multiple dental implants installed all at one time, like for a full arch implant procedure or an all-on-4, you also have the option of sedation, where you sleep through the entire thing just to tune it all out. Now, aside from dental implants being non-invasive to your other teeth, they also offer another huge perk: longevity. Compared with every other tooth replacement out there on the market, dental implants outlast and outperform other things like bridges and dentures. The key is to take care of your implant properly by brushing and flossing around it every day and choosing an experienced implant dentist to perform your procedure. I also highly recommend a water pick for implants. Even though implants don't get cavities and aren't real teeth, you still need to keep that surrounding gum and bone tissue healthy. So good oral hygiene is a must. And then there's the way that they feel. Since implants are shaped like a tooth root and stand independently, you don't have to worry about them taking up extra space in your mouth, which usually happens with dentures and partials, like those extra little wire rods. This feature means they're easier to talk and eat with, and there's really not any major adjustment time once your final restorations have been installed. Keep in mind, dental implant treatment is not a process you want to rush through. Even though there are case-by-case situations out there where implants are placed in one day, most patients require anywhere from 3 to 6 months from start to finish. But before you freak out about the time commitment, know that your dentist can still work with you so that you have something temporary to wear. That way, nobody sees visibly missing teeth. The reason for the time commitment is because we need that bone to fully integrate around the entire implant. If you put biting forces onto the implant too soon, it might fail altogether. Okay, so what about the cost? You're probably wondering, how expensive are dental implants anyway? I've got good news and I've got bad news. The bad news is that yes, dental implants do tend to cost more upfront than other types of tooth replacements. But get this, the good news is that they usually last longer. They don't have to be replaced, and in the long run, they actually wind up saving you money because of the one-time investment that you're making. Plus, you can always apply insurance coverage, health savings, and flex spending account balances toward the cost of your implant, or finance it at a low monthly rate with little to no interest accrued. So are dental implants worth it? Absolutely. And they're exactly what I would get if I had a missing tooth. With implants, you get to enjoy something that looks and feels so much like a real tooth. Nobody ever has to know that you had a missing tooth to begin with. All right, that's it for this one. If you found this video helpful, hit the thumbs up, subscribe, and I'll see you in the next one. Bye.